back to the Miraculous Mamas podcast. I'm your host, Elizabeth Joy, and we believe in empowering people through storytelling and education. If you missed last week's episode, go back. Dr. Glenn Robinson is on talking all about getting healthy. We do a lot of nutrition on this podcast. He introduced me to myopractics. I had never heard of it before, and he shares some of that with us. And just like some simple tips on getting healthy. And he has an awesome book out right now, Healthy Dad, Sick Dad. And you should go buy it. I really enjoyed chatting with him. And today we have a fun episode. I have on Sophia, and she is a registered dietitian, and she helps women ovulate. If you're not ovulating, she helps you ovulate, get pregnant, and stay pregnant. And she's going to tell us how she got on that path, why she's passionate about it, but we're actually not even going to talk about that today. We're going to talk about finding a provider and advocating for yourself. It's a topic that she's really passionate about and that I'm really passionate about because we've both had those experiences, and we know so many people that have had those experiences of going to your provider and trying to share with them what you're going through and just either being completely dismissed or they're unwilling to work with you, or they only have like one answer and you're like, I really don't want to take that route. What are my alternatives? And you just kind of get the eye roll and the, well, there's nothing else I can do for you type of thing. So she helps us see how to find a provider that's going to help us. And if you're in that trying to conceive phase, the questions to ask, what you should be asking your doctor, and how not to get that typical response of like, oh, you want to start trying to conceive? Okay, come back in a year if you don't get pregnant. So she gives us some great tips for that. I'm super excited to have her on, and I know that she'll be back to talk about the millions of other topics that she and I are both really passionate about. Before we dive into the episode, if you're listening and you are not subscribed, make sure you hit that subscription button and follow us on Instagram, and make sure that you leave us a rating. Also, next week, Vito's going to be on the podcast. We're going to do a little Q&A and just share some stuff with you guys that's been going on in our lives lately. And I always love when he comes on. I love when Vito comes on the podcast. I just love talking with him. Like, I don't talk to him enough. I just talk to him all day long. But I love him so much. So I love when you guys get to see a little glimpse of him on here. So if you guys have any questions for us, make sure that you write in and we'll do our best to answer that. All right, we're going to dive into the interview. All right, everyone, I am super excited about today's episode. I have Sophia here, and she is known as the Trying to Conceive nutritionist. She's a fertility dietitian, and I had her on an Instagram story before, and I just had such a great time talking with her because I'm very passionate about this topic. Because there's so much that goes into having a baby that we don't really talk about. So, I'm excited that she's here to offer her expertise.
I'm here to offer my expertise.
And to help us learn how to advocate for ourselves when it comes to having a baby, what important questions to ask our doctors, and how to get the ball rolling instead of just being told, okay, try for it.
Try and come back in a year.
Right.
Which I love and hate that advice because it's not really advice, but I see why doctors say it. And so what we're going to talk about today is just kind of like equipping yourself, being ready to have that conversation, and, you know, going into that appointment ready to partner with your doctor. And that's really the way that I want you to see your relationship with your physicians as you're trying to conceive, even when you become pregnant, when you're getting ready to birth your baby, like all of those things, seeing them as a wise expert that you consult, where meanwhile you are the queen, you are the president. Mm-hmm. He's the secretary of medicine. Okay?
Yeah.
So you make the decisions, but that's a wise person to ask when you're trying to.
Right.
So that's a way to look at your relationships with your physicians.
Mm-hmm. Yeah, I'm super excited to talk about it. So before we dive into it, I'd love for you to tell us, how did you get into this work and what brought you to be passionate about helping people be knowledgeable on trying to conceive and the steps that they need to take?
So it really, as many of us dietitians began in our fledgling nutrition careers, it started off with me having health issues that my doctors couldn't really solve. And I knew nutrition was a piece of it, but they were just really not equipped to help me with that. And, you come in with GI issues, the best you can get is like a Prilosec prescription. You're really not going to get much from them. They'll maybe do like a scope. They'll maybe take some blood and look for, these blatant, do you have like a roaring tapeworm parasite or something like that? But other than that, they can't really help. So that kind of started my journey of wanting to learn more about food and what it did. And I was in like 7th grade at that point. And then as I grew up, I knew I wanted to be in healthcare. So I kind of thought I wanted to work as a physical therapist, and I got a job in a physical therapist's office. And I was like, boy, this is sad. This is really a sad place to be, because this is mostly people who are very, very, very overweight, and they have diabetes, and their joints are giving out because they can't support all this weight. So they're having like knee and hip and back and ankle problems. And these doctors are performing surgeries on somebody with out of control diabetes in really poor circulation. And then these people just have so many complications. And I was just, like a little assistant that like got you your ice pack and stuff. So I wasn't really like treating anyone, but I had this one, and nutrition had become a big interest of mine. And there was this one patient who had fallen down some stairs while helping her daughter move. And she had broken a bunch of bones in her foot and torn a bunch of ligaments. And her bones were not healing. And she was very overweight. She had high cholesterol, high blood pressure. And her doctor told her, you need more calcium, so I want you to eat cheese for every meal. And my eyes about bugged out of my head. I was like, why would you tell someone who is obese and who has high blood pressure and who has high cholesterol to eat nothing but cheese? Like, are you out of your mind? That is negligent. That is not helpful to this poor woman who's just trying to walk again. And so I stepped way out of line. I was like, okay, no, cheese is not the answer for you. Okay, let me tell you something. There is more calcium in green vegetables than you will ever find in cheese. So you can eat cheese, fine, I don't care. But put that cheese on broccoli and on spinach and on kale. Eat greens, because that is where the calcium lives. And she was like, I'd never heard that before. And I was like, well, it's true. And it was just kind of this aha moment, because this woman she wanted to be well. She wasn't lazy. She wasn't stupid. She wasn't, entitled jerk who just was expecting the doctors to just do everything for her while she sat on her butt. She wanted to be well. She was doing her best. She was doing what her doctors told her to do. And what they told her to do was really, at best, incomplete. Mm-hmm. And I was like, okay, I want to do something about this. I want to serve these people. So I decided that I was going to go to school, become a dietitian, and go down that road. And after all my schooling and supervised practice, and even stepping into practice, working with many different populations, while that one woman wasn't lazy or entitled, I found that a lot of populations, that was a lot of what was going on. And I would be doing so much work to try and serve all these different people, and they didn't give a flip. They did not care at all. They did not want to change anything. They wanted to do exactly what they were doing, and just consequences be damned. And it was up to the medical system to keep their poor suffering body alive. And I was like, this is a waste of my education. This is a waste of everybody's time. I mean, I believe in personal freedoms. If that person doesn't really want to do anything different, why are we trying? Let them live their life, and we can go on to the people like this first woman who desperately wanted to be well.
All right, we're going to take a quick break to talk about something that all of you have heard about by now, and that is CBD. And not all CBD is the same, which is why I love the company Feels. One thing that I love about them is that they have a free CBD hotline to help guide your personal experience so that you find the perfect dose. The Feels customer service team is dedicated to making sure you get the best use of your CBD. So Feels, it's a premium CBD, and it helps keep your head clear and helps you feel your best. It's hassle-free. It gets delivered right to your door, and it naturally helps reduce stress, anxiety, pain, sleeplessness. There's no hangover or addiction or anything like that. You just place a few drops under your tongue, and you can feel a difference within minutes. Joining the Feels monthly membership makes your self-care so easy, and you're going to save on every order, and you can pause or cancel anytime. Start feeling better with Feels. Become a member today by going to feels.com/mamas. You'll get 50% off your first order with free shipping. That's FEALS.com/mamas to become a member and get 50% automatically taken off your first order with free shipping. Feels.com/mamas.
So in that frustration, I found that some acquaintances and friends of mine wanted to have babies, I started looking at, I wanted to be a midwife, I thought. And so I was going down that road in school for a while and found I can't stay up all night. Can't do it. It doesn't work for me. I can't think. I can't do high-level tasks. I would be a danger to everyone. So I was like, how can I help pregnant women? Because in them, women who are on the road to being moms, want to be moms, there's the motivation I was looking for. There is the patient that's going to move heaven and earth in order to see results. There's somebody who wants to make a change and who's willing and able. And so in that population is where I found the type of patient I wanted to work with. And then once I started helping families grow, oh my God, it was like the most addictive thing. Like you just can't get enough of seeing those healthy babies be born, or seeing those positive pregnancy tests, of hearing those testimonials of people who have been trying to conceive for years, who change some things around and have their miracle baby. It is just my favorite thing in all the world. So here I am doing my favorite thing.
Mm-hmm. That's awesome. Side note, quick, you said like you couldn't stay up all night, and I was at a birth yesterday, and the midwife that I was working with had a shirt on that said midwife by day and also midwife by night, because babies come whenever they want. And I was like, that's such an awesome shirt, because
oh my gosh,
I know that she was there because 2 other doulas got called in last night. So I know she had a crazy busy night. She was there from 4 a.m. till like, I don't even know what time, like today. So I'm like, man, that is, it's hard.
My baby was born just after midnight, and that sounds like, oh, good. The midwife then, got to get to bed at a decent hour. No, the midwife's work really starts when the baby is born. And so she didn't even leave my house till like 5 a.m.
Mm-hmm.
So
yeah.
There's a lot to do once the baby comes.
Mm-hmm. But I love your passion for helping people. Because like what we're going to talk about today, I just feel like in the majority of the medical system, like they're taught a very small part of nutrition, and then that's it. And if we're going off of the food pyramid that we have today, it's very incomplete.
But we don't even have a food pyramid. We have My Plate now.
Oh, I don't even know. I'm not up to date.
We've changed it from a pyramid to a plate.
Okay.
A plate that's divided into 4 sections, and then there's a special cup in the corner just for dairy.
Okay. I did not know this. So a lot of people on here know that I struggled, not necessarily in getting pregnant, but I had a lot of period issues. I've had like 3 transvaginal ultrasounds because they're like, well, let's check for cysts. Let's check like what's going on. After I carry a lot of my emotion in my ovaries. So after my grandma died, I had like the heaviest period of my life. I thought I was dying. My husband at the time was my boyfriend, and I was living downtown Chicago, and I was like, you have to come get me. Like, I would put a tampon and a pad in and bleed through everything within 30 minutes. And I'm like, wow, what's going on? And I had just moved here. I didn't have a gynecologist here. I loved my one that I had in Vegas. I went to this like awesome homeopathologist. She was like a general practitioner, but she also just did my annual exams. And she was just amazing. And she would talk about like emotions. Like she kept notes on me. So every year I came in, she knew like the name of my boyfriend. She knew my pet. She knew where I worked. And she'd be like, how are you? Like, just awesome. It was like very holistic. So I went to their family practitioner here, and basically there was no answer for my heavy periods. He suggested that I get on birth control, and I said, that's really not an option for me. And then he rolled his eyes at me and was like, well, then I don't know what to help you with. And and then I started learning more about my body, that a lot of the symptoms I was having are very common, but they're not normal. I should not be having the PMS that I was having. I should not have been having these super long, super heavy periods. And that's a sign of overproduction of estrogen. So then I finally, after years, like I had Dr. Patrick Flynn on the podcast, and he ran all these different labs on me. We found the answer to like, hey, this is what's going on within your body. And then I was able to work on it and fix it. But I had to advocate for myself. I had been to like 3 different practitioners. And I wasn't willing to settle for just here's a pill to cover it up, because I'm like, no, my body's trying to tell me something. There's something going on. But it's hard advocating for yourself. Like when your doctor rolls their eye at you, then I'm like, wait, should I just get on birth control? You know what I mean? Like I could see how easy it is to be like, well, they probably know, they're the expert.
Yes, and they are an expert in some things, but you have to know what is your doctor an expert in, and come to them for that, because no one knows everything. And depending on who your doctor is, they're an expert in various things. Like my gynecologist is a gynecological surgeon. When I had to have polyps removed, she was the gal. Like when I had to find the polyps, when I, figuring out what was going on and removing them and treating them, she was the best. She's a very skilled surgeon. So a skilled surgeon is wonderful at the 5 ways to manage a bleed during this kind of incision, how to do these types of stitches in the uterus, how to work with this sort of anesthesia when you're doing this kind of cauterization. And they hold in their brains all of that material. Which food is highest in selenium? Not on the list when it comes to surgical management of gynecological issues. So you're talking about right now something that I want us to think about when we are approaching doctors. Who is this doctor? What is their specialty? And what do they do all day in their practice? Because everyone, I'm a dietitian, she's a gynecologist. Just because I'm a dietitian, does that mean I am great at managing the nutritional concerns of somebody with chronic kidney disease? No, my specialty is fertility. I work on how to help women get and stay pregnant. That's the research I read. Those are the webinars I attend. That's what I'm doing day in and day out. If you have kidney failure, go to the kidney failure dietitian. Just because someone is a dietitian doesn't mean that they're an expert in all these things. I mean, I could probably figure out how to not kill somebody with kidney disease based off of my education experience there. But am I going to be helping that person like thrive and live their best life? No, I don't know how. I don't do that all day. So when you are deciding on a practitioner, don't just go for whoever you've always gone with because you like their personality. If there's a problem, find somebody who can help you with what you need. And you may have to go to a few different people and talk to them and be like, what do you specialize in? You know, what how do you spend most of your time? Just like in birth, if you want to have an unmedicated natural childbirth, should you go to the OBGYN who does 80% of C-sections?
Right.
No, because what are you probably going to end up with? The C-section. That's what this doctor does. If you want to have a C-section, should you go to the doctor who does 3 C-sections a year because they're the expert on natural unmedicated birth? No, that is not the person you want doing your C-section. You want to go to the person who does what you're looking for day in and day out, who's awesome at it, really well practiced. That's who you want to go see. And you may have to talk to a few different practitioners until you find somebody who does what it is you need. But before we even get there, we should probably talk about, well, how do you know what you need? And what do you even do when you talk to these doctors?
Right, exactly. Because I feel like what I've heard from a lot of people is that when they decided they wanted to have a baby, the practitioner's like, cool, go for it. Like you said at the beginning. And if it doesn't happen in a year, come back. We'll run some tests, basically.
Yes. Or if it doesn't happen in a year or you have 3 miscarriages in a row, then we'll do these tests. And that sounds horrible to a lot of people.
Well, because when you're ready, you're ready. Like we're kind of taught like take birth control and then so that you don't get pregnant. But when you're ready, stop. And then you're like, wait, I'm ready. Now I have to wait a year to see if it's even going to happen.
Yeah.
Like, what the heck?
That's the secret sauce of what I do. That's where my magic comes in, because women fall into 2 categories. I don't want a baby. I wanted a baby yesterday. You know, I want to be pregnant yesterday. These are the 2 categories of women. You know, we're painting with a broad brush here, but generally that's kind of how it goes. Like, I'm not interested in being pregnant, or I want to be pregnant ASAP.
Right.
And our bodies don't always flip a switch like that, especially when there are other problems going on.
All right, we are going to take a quick break to talk about taking control of our mental health. And you know, that is why I love partnering with BetterHelp, because they make it so convenient, affordable, and just easy for you to be able to get the help that you need. You can communicate in whatever way you feel comfortable, whether that is texting, emailing, a Zoom call. They make it so that you can meet with your counselor in the way that you want. And they're professional. You can check out their testimonials. They have so many. And I just know, as a lot of people listening, either you're trying to conceive, you're pregnant, you're new parents, or you're even further on in your parenting journey. But so many things continually come up that show us that we have more to work on in our lives. I feel like around every corner, every season is just a mirror reflecting what we need to work on, and it's okay to get help. Sometimes that's what you need. So that is why I love BetterHelp. They're always there for you. You can get a timely and thoughtful response and schedule weekly video or phone sessions, whatever you want, and you never have to sit in that uncomfortable waiting room. I want you to start living your best life today. And as a listener, you'll get 10% off your first month by visiting betterhelp.com/mamas and join over 1 million people taking charge of their mental health. In fact, so many people have been using BetterHelp that they're recruiting additional counselors in all 50 states. So head to betterhelp.com. That's BetterHelp, HELP.com/mamas.
So when you decide you want to have a baby, if that's on the horizon, I talk to a lot of women when they're like getting ready to get married, or they just got married, you know, they're settled into a relationship now, and they are thinking about getting pregnant in the next coming months or years, what should they do? So I recommend that you start eating for fertility and stop all hormonal contraceptives at least 6 months before you want to become pregnant. And part of the reasoning for this is because hormones involved in preventing pregnancy change the structure and function of your sexual organs and your brain. So it actually changes the physical structure and the function, because function follows structure, right? So if you're taking birth control pills or a hormonal IUD or a patch or an injection, or I don't even know what other kinds of things that are available right now, the way that it works is it shuts down your ovaries from ovulating. That's one of the ways that it works. It also can thicken cervical mucus and all these things. But basically, it shuts down your ovaries from ovulating so that they are not making an egg every month. There's no egg there to get fertilized. When this happens, the way that this happens, how do you keep an ovary from ovulating? Well, you shut it down and you shrink it down. So women taking these hormonal contraceptives, they have up to, or sometimes more than, a 50% shrinkage of their ovaries. We also see every woman taking this has clitoral shrinkage. Every woman taking this has thinning of the vaginal wall. Every woman taking this has changes in her breasts and her pituitary gland as well. Pituitary gland is in your brain. Now, to what degree? You know, some women have extreme thinning of the vaginal wall to where penetration is incredibly uncomfortable or even painful. Some women, it's like a 2% change and they're like, man, I didn't even notice. Some women have a shrinkage of their clitoris of like 40% and they can't achieve orgasm or even enjoy sexual stimulation because their clitoris shrunk away. Some women, it's like a 3% change and they're like, I barely notice it. Across the board, though, all women have shrinkage of their ovaries. So when you come off of birth control pills, stop taking them, it can take a while for those ovaries to grow back to normal and to begin to get that nourishment to have quality ovulation. Now, this doesn't happen with absolutely everyone. I mean, we know that some women get pregnant because they missed 2 days of a pill or 1 day of a pill, or they took it at a different time that day. We know that some women get pregnant immediately when they stop taking the pill. So like I said, some women experience a lot of this shrinkage and some women it's more slight, but the shrinking happens to everyone. That's part of how the pill works. Or the pill, the patch, the IUD, you know, whatever route you're getting these hormones into your body. So when you're coming to just be like, hey, I want to be pregnant yesterday, that's part of why I recommend you come off of these methods at least 6 months prior to trying to become pregnant so that you can kind of let your ovaries come back online and begin to have that quality ovulation. Some women, it happens immediately. We see this every day in practice. For other women, it does not happen immediately. And those are the ones that kind of end up with me because nobody's going to pay me big bucks to, you know, brag about their health. Well, I got pregnant so easily. How can you help me?
Right. But you're not going to know which one you are until you get off the birth control. So that's why you need that time. You can't just be like, oh, okay, well, I'm sure my ovaries are fine. You know, like you don't know which one you're going to be until it's time to have the baby. Or to get pregnant.
And there is no test you can run to know this. Okay. You can't go to your doctor and demand blood work to know how this pill is affecting you. It doesn't work like that. So if you are trying to conceive, you want to have a baby, come off of birth control pills 6 months at least prior to when you want to start trying for that baby. That's my first recommendation for when you're trying to conceive. And if you're not ready to have a baby at that time, that's fine. Use a barrier or enjoy each other in a way that it doesn't involve penetration.
Mm-hmm.
You can do both of those things and, you can still have a pretty good time.
Right.
So that is my first piece of advice when you're getting ready to try to conceive, is to come off of whatever hormonal contraceptive. I even say this for the copper IUD, because even though there's no hormones in Paragard, the way that it works is to cause so much inflammation and irritation in your uterus that a baby cannot implant. So that's the function of that, is to make your uterus inhospitable for a baby. Getting that removed early rather than later is, a better way to kind of let everything regenerate and heal from where that IUD once was.
Mm-hmm. I also just want to say, I know like you're big on dietitian or in nutrition too. So like when you get off birth control, if you want to have a kid in 6 months or whatever, that's also where like health stuff comes into play, but not only for you, but for the partner. I feel like the partner gets left out so much. And I'm like huge on sperm health because I feel like there's so much weight on the woman. So whatever advice besides hormonal birth control, because that's not offered to men, whatever health advice for women for like eating and things like that, like also applies to men.
It can. Yeah, it can. Oftentimes they're not faced with the same kinds of, because a man's contribution is a sperm. A woman has eggs and tubes and a uterus and all the hormones involved in pregnancy and all the blood flow involved in pregnancy. And then because they don't just have to provide an egg and then they're done, they go on to carry that baby and birth that baby and feed that baby for years to come. So while the initial conception is definitely, a 50-50 situation, the needs of the mother
after,
that can be just as big a piece of the fertility puzzle as sperm can be. Because there's one thing that men are contributing. Women, there's many, 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 many things that need to be just right in order for that baby to come about. So that's partially why I don't really work with men much either, because I'm like, snooze fest.
Yeah. Well, I've just known like a lot of people who have gone through like IVF or IUI, and they were told that their partner does not need to make any changes in their partner's drink and smoke and whatever. And they're like, oh no, their sperm's fine. And that just like bothers me.
It bothers me too, because I'm like, so what, are we just going to have a baby so that the dad can die of a heart attack at 40? Is that the dream? Right. Is that your dream?
Yeah. Not really.
No, that's not your dream? Okay, well, we maybe need to think about what's an even bigger issue for men, and that's heart health, and all of these kinds of things you got going on are a recipe for a foot in the grave by the time a 4 comes to the beginning of your birth date.
Yeah.
So that's definitely an issue and absolutely something to work on. And yeah, if sperm health is in line, congratulations, your lifestyle habits haven't started killing you yet, but you don't want to live a life of like drinking and smoking and eating fast food if you want to live a long time and have a good quality of life for dudes. That's for sure. And if there's sperm issues, then got to work on it. And if your wife is making nutrition changes, you're a dick if you're sitting next to her drinking and smoking and eating Doritos. Okay.
Yes,
I don't
that's
care
true.
about your balls. You're a dick. That's what I have to say about that. Like, can you support her and like help her and be like, okay, this is going to be great. We're going to get healthy together. So,
right.
How about 2 nights a week? I look at something that we can, I'll come up with the recipe. I don't really know how to cook it, but I'll come up with what to do. And then you're like, great. Even though I'm the one who knows how to cook, the mental load is gone. I get to show up in the kitchen and the recipe is there and the ingredients. Yay. That's like a cooked stream right there, right? It's all there ready for you. So anyway, even if your sperm is healthy, don't be a dick. Don't sit there drinking and smoking and eating chicken nuggets while your partner is struggling with her green juice. No, I don't even advocate for green juice, but like she's drinking a green tea and you've got a pumpkin soy, whipped cream, every kind of thing. And she's like, dude, I hate you. Stand with her. This is the woman you want to have children with.
Yeah. Yeah, for sure. That support is huge. So after like getting off birth control, what are the things that you'd want to ask your doctor when you're like, hey, I'm ready to try to conceive?
Yeah. Yes. So the best thing is to look at your doctor as your partner, as a partner. Okay. Not your Lord and Savior, not a wizard who is going to have all of the answers for health and know everything about your life. Your doctor's just like you, just with a different education and experience. That's it. There's no magic there. There's nothing that's going to make your doctor more capable of knowing about you than you. So come to that appointment, come to your doctor like you are sitting down with a teacher at their office hours, like when you were in college and professors would offer office hours, or like you're doing, an after-school tutoring session with your teacher if you didn't go to college and you just went to high school. How would you approach that? Well, you probably have a topic that you were wanting to work on with them, and you'd have specific questions or things that you needed help with. And that's what I really recommend showing up to your doctor with. Don't just pop in and say, I want to have a baby, because they'll be like, good for you. Do you know where babies come from? Sex.
Yeah.
So go have sex. And if that doesn't work, come back. Because that's all they've got, right? They don't have a crystal ball into your life. And really, fertility protocol and research supports that if you're under 35 years old, taking about a year to conceive is fairly common, pretty normal. If you're over 35, they like to say 6 months because your fertility years don't last forever, and they don't want to take like an entire year of your fertile life. And, they say 6 months. So that's because we want to make sure that we have ample opportunities to have sperm and egg in the same place at the same time. And not every sperm is a champ and not every egg is a queen. And so we like to give it 12 months so that there is enough time for the two to come together. And that's all well and good. Healthy couples with nothing going on, I totally support that timeline. I do not recommend you spend hundreds on lab work and do all kinds of invasive tests and look into all of these natural healing methods and everything like that if you haven't actually put sperm and egg together several times to see what could happen. Because for most everybody out there is healthy and can conceive a baby without issue. Something like 85% of couples will conceive within a year. So that's a pretty big percentage. But
I also feel like there's lack of education there, though, because I recently had a friend talking to me. Mm-hmm. They've been trying for a few months. They're both healthy. And I told her, I'm like, well, make sure that you're having sex. She's tracking her ovulation, and on her ovulation day, she's doing it. And I'm like, have sex leading up to your ovulation day. And she's like, I had no idea. I didn't know that. And she was told, like, hey, day 14, do it. And that's it.
Yeah, there is a lot of lack of education there. And maybe we can do an episode on that sometime.
Right. I just wanted to throw that in there for like real quick. Because even like with the healthy people, they think like, hey, I'm doing it on this day every month, but I'm not getting pregnant. And it's like, okay, well, there's days leading up to it, blah, blah, blah.
Oh, absolutely. Not every woman ovulates on day 14.
Right.
And that is definitely true. So we have to remember, we're trying to get egg and sperm together. So with what I'm talking about here, we're getting egg and sperm together. Mm-hmm. So let's just hypothesize that we are getting egg and sperm together consistently for several months. And that's what your doctor's looking for when they give you that 1 year timeline, is for egg and sperm to be together consistently. And if you are doing that and you still don't get pregnant, Then they want to run some labs. Now, that's fine, but we're like, kind of like what you're saying, we're assuming a lot in that timeline. So we're assuming that egg and sperm are happening, whereas for a lot of women, egg may not be showing up. You may not even be ovulating. And so if you're having symptoms, you need to be on a different road with your doctor than just wait a year. If you aren't having symptoms, like you are having regular periods, you're not, having debilitating pain or soaking many tampons and pads every hour, you're not having bleeding in between periods, you're not having like migraines and acne and depression. And, these are medical problems. If you're not having medical problems, and you didn't go on the pill because of medical problems, you went on the pill or the patch or whatever because you didn't want to become pregnant. Now you do. So you're stopping taking it. Then that 12-month road is totally fine. That is not negligent or bad of your doctor to suggest that you do that. It's fine. Now, if you are not in that camp, which if you're listening to this podcast and you're following me at all, it's not because your health is so great. There may be things going on that make it to where there are some concerns. Like if you have any of the things that I just mentioned, that's worth talking to your doctor about. Okay. Remember, we're partnering with our doctors here. So we're coming to the office like you would come to your professor's office hours or to tutoring help with your teacher. You've got a problem and questions, and you are looking for this person who's an expert to help you. That is a very different conversation than I want to get pregnant. And you just kind of say that and let it lie there. And your doctor's like, good for you. Stop taking the pill, take a prenatal vitamin, come back in a year. Showing up, like when I wanted to get pregnant, I went to the doctor and I was like, okay, I want to have a baby, but here are my concerns. My cycles are only 21 days long, sometimes only 19 or 18 days long. I'm having spotting in between periods. Something isn't right. And my doctor was like, yeah, that's not right. So let's look. First, she wanted me to, confirm my ovulations to make sure that I was ovulating. And she wanted me to count the days from when I was ovulating to when I started bleeding, because a 21-day cycle in of itself isn't necessarily awful if you're ovulating on, day 8, which some women are. That wasn't my circumstance. I was ovulating on like day 14 or 15 and then starting to bleed on day 20, 21. So I came to her with a concern and some data. That is very important, listeners. Come to your doctor with your concerns and with your data. Come to your doctor and say, I don't know if I'm ovulating. This is what I've seen. I've been doing these strips. They seem kind of inconclusive. And when I am, the day that says that I'm ovulating, I don't know if that's really what's happening, because then I don't get my period for another 3 weeks after that. Or whatever pieces of the puzzle you have, write them down and come to your doctor for that. Because in the instance like what I had going on, whether or not I ever wanted to be a mother, having cycles that short and bleeding in between periods or spotting in between, that's a sign of a health concern that has nothing to do with whether or not I ever want to have a baby. That's a health concern of just a woman with a body and a uterus. So sometimes our concerns are health related and they aren't just fertility related. So come to your doctor prepared with anything that you've got going on that doesn't sit right with you, and ask for their expertise on that topic. For me, it was the short luteal phase and the spotting. Lo and behold, we found a luteal phase defect. We found uterine polyps. We found an endometritis infection. Like there was a whole mess going on with me that we were able to treat, and I was able to get pregnant afterwards. So that would be a great thing to do with your doctor, is kind of set it up like a teacher-student relationship, not a you're the doctor and you know everything, and I'm this bumpkin who can't even tell whether or not I am having ovulation. And it's okay if you don't know whether or not you're having ovulation, but like show up and be like, I don't know, and let them help you. Mm-hmm. You know what I mean? Like, I just see so many times women, we are so used to being pleasing mm-hmm. and not making waves and just kind of doing what we're told, that we show up to these appointments and the doctor just, says what they say, and we're just kind of blink at them and go, okay. And then we leave and we're like, what the freak just happened?
Right. Kind of seeing them as this like authoritarian figure instead of this partner,
teacher,
right. mm-hmm.
expert.
Right.
Mm-hmm. So seeing them as like, imagine you're the president and they are the secretary of medicine. Mm-hmm. Just like we have a president and a secretary of the interior and a secretary of defense and all these different offices within the cabinet of the presidency, you are the president of your health and your body. You can't possibly know everything, so you hire people who know things to consult you as you make decisions. That's the way to look at the doctor-patient relationship. Not that they're the great and powerful Oz and they, don't look behind the curtain, or what they say goes. And, well, my doctor said to wait a year. And ladies, my doctor said, quote unquote, that's not a good enough reason for me, for anything. Mm-hmm. My doctor says to take this prenatal. Well, your doctor could be wrong, could be right. What were the reasons? What's this prenatal doing for you as opposed to other ones? Why are you waiting a year specifically? Because their policy says wait a year isn't good enough. Why do you, Liz, need to wait a year? Mm-hmm. Because you are the patient. You are a unique individual. And your doctor needs to be making decisions with you as a unique individual. So that's step one, changing your mindset about your doctor to where they are your partner. They are a consultant. You're the CEO, mm-hmm. not the other way around. Not that they're the CEO and you're the employee and they say, go get this blood work done. And you go, yes, master, and like run off to go do it. No, it's the other way around. And you can give them all the respect and honor in the world. And I recommend that you do, because they are an incredible resource, but they're not God and they don't know everything. And if you can't share with them all of your concerns and details about your health, and then they aren't going to be able to do their job, which is consult. Mm-hmm. They need to know the situation they're consulting on.
Mm-hmm. Yeah, that's good. I feel like you have to come, like you said, equipped to the appointments.
Yeah.
With questions. I always try to write questions down, before I have a midwife appointment or Jovi has a pediatrician. I'm like, anything that's come up in the last 6 months or whatever it is, I'm like, I have to write this down, because otherwise I'm going to leave and be like, oh my gosh, I forgot to mention this thing.
Totally. Mm-hmm. Write things down. And Liz, like you said, if your doctor rolls their eyes or is disrespectful to you, you are not obligated to continue working with that person. Mm-hmm. You don't need to be disrespected. If you show up with a big toot demanding heaven and earth and treating your doctor like they're your slave, then don't be surprised if they dish it right back to you. Right. But if you are respectful and you are, firm but respectful, and they don't want to help you, that is not the doctor for you. You need to, especially going into a pregnancy, which is the ultimate goal. Mm-hmm. No. You do not need someone who's going to be treating you like you're dumb or that you're their peasant and they sit on this cloud of judgment and dispense life lessons down to you. That's not the situation that you want to have with your physician. But it's also not the situation that you want to cultivate by coming in, demanding the world, and threatening lawsuits or whatever if they don't hop to and do exactly what you want when you want it.
Mm-hmm. I feel like, though, I guess in my experience, I never, because I was so clueless, because the first time I ever got a transvaginal ultrasound, I wasn't trying to have a baby, but I was spotting between periods, and I would all of a sudden be at work and get this really sharp pain in my ovary. I would spot, and then sometimes I'd get like a headache or tunnel vision or something. And this was years ago. And I went to the doctor, they found nothing. But at that time, I didn't know how to I'm like, okay, well then nothing's wrong with me. Like I didn't really know how to ask for more or how to even advocate for myself because I didn't know any differently. And it eventually kind of went away because at the time I was working with the homeopathologist on my thyroid health and doing some other things naturally. I don't know if it was connected or what, but then it kind of came back a little bit later. And I just kind of took those answers of, okay, then nothing's wrong with me. So if you go to the doctor, let's say you went to the doctor and they're nice, you're nice. You're like, hey, I'm only having 21-day cycles. I'm not sure if I'm ovulating. And they're like, you know what? Why don't you just try for the next 6 months and then come back?
Mm-hmm. That's terrible. And you need someone who's going to find out whether or not you're ovulating and help you know and actually try to answer your questions. And if that is not what this person is going to do, that's not the right person for you. And you have to keep in mind, okay, the American College of Obstetrics and Gynecology, they see every kind of patient, every kind. So obstetrics and gynecology, they don't actually see patients. They're a governing board for people who see patients, right? So American College of Obstetrics and Gynecology, they issue guidelines for every kind of patient. And in America, we have kind of really pushed for this model of care that's very inclusive, right? We want everyone to get the same treatment. We want everyone to, no matter who you are or what you've got going on, we want you to get the same care and that it's accessible to everyone. It's the same. And that sounds wonderful, right? But let's look at what actually happens. When we adopt that model of care, we are trying to give the quote unquote same care to the 30-year-old CEO millionaire who is very well-read, well-educated, and is looking for deep answers. We're putting that person in the exact same bracket as the person who is 14, pregnant by accident, doesn't have a consistent place to live, isn't even sure how she became pregnant, no access to healthy food, doesn't even know what's going on in her body whatsoever. And we've put them and everyone in between in the same boat and said, you're all going to get the same care from this gynecologist. And if they treat you at all different, then we can sue them. And so what happens? Unfortunately, we take everyone, no matter how educated or how capable they are, and we put them all to the level of who struggles the most to understand this information, who has the most barriers to a healthy baby. We put them all in that category. And so talking to this person, this, young, scared girl who is pregnant by surprise, doesn't even have a consistent place to live, very much struggling nutritionally, financially, socially, just nothing's going right for this poor gal. And to give everyone that exact same level of treatment means that that's the kind of treatment that you're going to get, because we can't give her the same thing we give to this wealthy, educated woman. We can't tell this 14-year-old girl to start eating organics and take methylated folate and to do pregnancy yoga. We can't tell her to be monitoring her cervical mucus and charting her basal body temperature. And she doesn't even know which hole's the vagina. She's like a brand new hatched little chick. She just doesn't know what's going on. She's struggling just to eat and survive every day. And so when we have this model of care that is inclusive and includes everyone, we force doctors to treat everyone like the person who is struggling the most. And so if you were that doctor and you were just trying to get this girl to not eat out of the garbage can and be like, it's not safe to eat certain foods, you would tell her the biggest concern is lunch meat, right? Because you're like, God, how long has it been sitting out? Where did it even come from? It could be harboring so much bacteria, and that can kill this baby. If this lady is eating a lunch meat sandwich from her shelter that's been sitting out, and that's no bueno. Whereas someone who has clean hands and refrigeration and everything like that, telling her not to eat lunch meat is silly. She's not going to poison herself with spoiled food. But we have to bring everything down to the level of who is the most needy. Mm-hmm. So that's the kind of gynecologic and obstetric care. And so again, looking at what does this doctor specialize in? Going back to that very first step in selecting a practitioner, look around the waiting room. Are there people that are around your age, your place in life? Are they trying to conceive, or are they, on their fifth kid and they still aren't sure which one's the vagina? Are they, what's going on around you? Do you feel like you kind of fit in at this practice? Because I've been to practices where I look around and I'm like, wow, this is a great gynecologist. Everyone in here is 60. So that's really probably not the place for me. Mm-hmm. Because you know what? 60-year-old women need gynecological care too. And good for them. That's not the place to go when you're 22. And, look around. Is everybody in here pregnant and for prenatal visits? And you are nowhere near that in life, but you're having other problems. Maybe this isn't the right place for you. So anyway, these are things to look at and to work with practitioners that work with people like you all the time. Because if she has 10 appointments in a day and 9 of them are surprise teen pregnancies, do you really think that she is going to trust you when you say, no, I don't need to get this HPV vaccine. Me and my partner are exclusive to each other. She's going to be like, do you know how many times I hear that in a day? Yeah. And I'm sitting here with all these women that have these horrible infections because their partners are doing whatever, or they're doing whatever. You have to think about we don't like to do this because we don't want to judge people, and we don't want to limit access to care for the people who really, really need care, but just different than what you need. So instead of expecting your doctor to be able to care for everyone from the pregnant teen to the 77-year-old, find somebody that works with your specific needs, your age range, your socioeconomic grouping, to get care that's appropriate for you. If you've got a choice, make choices like that.
Yeah. Yeah. I mean, it makes sense if, like you said, like going to a doctor who's seeing somebody who works with the same like clientele all day long. So if it's all people in their, early 30s who are trying to get pregnant, and that's what the waiting room's full of, you're like, oh, okay, this doctor helps people my age try to get pregnant.
Yeah. Yes, and that's the research they're looking at. They're not spending all day reading about preventing neural tube defects in teen pregnancies, because that's the client, that's the patient set that they see, or people that are, really in a bad straits financially, socially, having a really hard time. And those people absolutely deserve and need care. So I'm not saying that doctors shouldn't be treating them. I mean, God knows they desperately need it. But that may not be the right place for you if that's not your specific situation. Yeah.
I mean, that makes sense. Are there any other things to look for when it comes to finding a care provider and advocating for yourself?
Those would be really the first things to look at. And then after that, I like to do kind of like a vibe check. That might sound kind of new agey and silly, but I really believe in women's intuition. Mm-hmm. And I think that you need to find somebody that jives with your own self. I mean, you're going to be in there talking about your sex life, your vaginal health, your digestive system, your poop. This is somebody that you need to be able to really open up with and tell them the full truth. of everything that's going on and not feel like they're going to roll their eyes at you or ignore you or rush you out of the room. You need to find somebody that you feel like you kind of jive with. And it does not need to be somebody that you would want to like go out and have a glass of wine with after your appointment, because remember, you're not auditioning people to be your friend or to be your neighbor. You're looking for someone who's going to help you with your specific medical needs. So finding somebody who jives with that, who is going to, you feel confident talking about your body and life and everything with them, and that you just feel good about seeing, and you're not like, oh, I'm really dreading seeing this person because I'm going to have to tell them that I've been smoking and or whatever, you know, like you want to go see somebody who's going to support you in the way that you need. Not somebody who's going to be your best buddy, but who's going to be able to, you just feel like confident in them. And it's the it factor, you know, like, I don't really know how to describe what it is you're looking for. I call it like the vibe check. Like what kind of a feeling do you get from this person?
Mm-hmm. Yeah.
And not just looking for them to be buddy with you, because that's not what you need. You're not looking for someone who's going to be your buddy. You need to find somebody who's going to be your doctor, who's going to be your partner in health, who's going to have that heart of a teacher, who encourages you to understand your body. And isn't just, you know, spending all day trying to get these pregnant ladies not to smoke anymore or to, you know, to stop drinking alcohol. And that's their biggest obstacle with their patient set, because that's a huge obstacle and you absolutely need to not drink or smoke when you're pregnant. But if that's what your doctor's doing and you're like, that's so not me, then that's not going to be a good match for you.
Mm-hmm. Well, I like what you said before about like finding somebody who's not only going to help you at this beginning part, but even are they somebody that you can picture at your birth, who's going to be there if you're working with somebody like that.
Yeah. And maybe, you know, that's a whole nother ball game.
Yeah.
Because somebody that you want to help you get pregnant is not the person that always the person that you want to be at your birth. Mm-hmm. Again, I value physiologic birth. I wanted to have a birth that honored the birthing process, that, you know, maintained the dignity of both myself and my baby. And I didn't see surgery as the way that I wanted to do that. So I chose to go down a different road. I mean, the person that helped me get pregnant, I needed to have surgery in order to get there. So I selected a skilled surgeon. Mm-hmm. She is not the right match for me. As much as I love her, she was not the right match for me when it came to how I'm going to birth this baby, because surgery was not going to be, that's not what I wanted to do. And, you know, it has a whole lot of risks and a lot of things about it that weren't what I was looking for. So I went and found somebody that understood physiologic birth and that could support me in that and was an expert at that, versus the person who's an expert at surgery, who's going to be like, oh, you want to have a baby? Scalpel, you know, just because that's what she's great at. Mm-hmm. And thank God there are people that are great at surgery. Thank God there's people great at physiologic birth. I tell you what, wouldn't want her doing a surgery on me.
Right. No, but I feel like that's like important to say too, though, because I feel like a lot of times though, too, people feel then a loyalty. Like, this person helped me get pregnant. They helped me through this. I don't know how great, we don't agree on a birthing plan, but I feel like I need to stay with them.
Run. I love my mechanic. They are so good, but they won't do my root canal.
Yeah. Mm-hmm.
I love my dentist. She's brilliant. So great. But she's not willing to fit me for eyeglasses. You know, like, you need to go to the right person for the right thing. And your dentist may be amazing. Don't expect them to be an ophthalmologist. Your ophthalmologist might be amazing. Don't expect them to be a podiatrist. Your mechanic might be awesome, but don't expect them to paint your house. You know, like you need to find the right person for the right job. And that could be maybe another episode, because that's something I'm really passionate about too, is the fertility conveyor belt, that when you needed a lot of medical help to get and stay pregnant, you kind of tend to feel like you want a lot of medical help to birth your baby. And those are very different things. And I see a lot of women kind of staying on this medicalized birth model because they needed a lot of medical help to become pregnant. And then they end up with a lot of birth trauma, with a lot of surgery, with a lot of unnecessary categorizations during pregnancy. And, they're told that they're high risk and they're, all these other things when really nothing actually was wrong. And then they end up having all this trauma because of it. But that can maybe be something for another episode, because today I think we just talked about choosing a doctor and starting the conversation.
Mm-hmm. Well, I mean, if you're listening to the episode, go follow Sophia because she has so much valuable information on her Instagram. Well, I learned so much from you. And the thing that I love is that I think just like your realness, because you see the the need for medical help. And then you also see the value in what you do, the nutrition of like, hey, some things you do need
never
this.
Think I was a dietitian from this episode. I didn't talk about nutrition at all.
Right. So how about you quickly?
It's one piece of what I do.
We'll quickly explain before we wrap up then, where do you come into the picture? So let's say this person's going to the doctor, they get these results, like what you went through, like you had to have this surgery, whatever, or maybe this person's not ovulating, but they don't need surgery. Like, where does Sophia fit into this picture of helping people get pregnant?
So I help with, if you're not ovulating, I am definitely a great person to start coming to start figuring out why. Your doctor can be good for some things when it comes to that, but they're not a nutrition professional. And I would say 9.9 times out of 10, when someone is not ovulating regularly, there is a nutrition and lifestyle component, whether we're talking about PCOS or hypothalamic amenorrhea. And with those two things, we are talking about probably about 90% of anovulation. And those are the most impacted by nutrition and lifestyle. So coming to see me for that, or if you want to get pregnant and you've been taking birth control pills for a long time and you're coming off of them and you just want to get your body in line, get ready for baby, get everything together. So I work with everyone from I want to get pregnant and I just want to prime the pump and get everything working well. I really recommend you do my online courses for something like that. All the way through, I've been trying for years and I am still struggling because there's a lot in my online courses for you too, but then that's where we can do more like supplement review and some one-on-one work to figure out what could be going on for you. So the biggest thing that I have to offer right now is my online course. It's called Fertility Nutrition Foundations. And if you want to work with me, join that course because I am only accepting one-on-one patients from people that graduate from that course. So you have to go through that first. And then if you still need help after that, that's where you can work with me one-on-one. Mm-hmm. And I started doing that because I had a terrible experience where I worked with somebody for months and I really thought we were making some progress. And I told her something to eat and she said, wait, rice is a carb? And I realized how deeply I had failed her, that she had spent thousands of dollars to work with me and she still didn't have the foundational knowledge. And this was someone with PCOS. Like, you want to talk about carbs impacting somebody's ability to ovulate. If there's ever an example, it's PCOS. And I was just like, wow, Sophia, you have really, really wasted this woman's time. So I decided, okay, we're going to go through this course where we learn all about ovulation, all about eating for fertility, all about supplements, exercise, self-care. We're going to just learn all these things. And then if you do all of that and you come to me and you're like, something still isn't right, that's when you can work with me one-on-one.
Mm-hmm. Yeah, that's awesome. And it's awesome that you recognize that too. I mean, you also want people to, if they're coming to you, obviously they're spending the money, so you know they want it. But I also know from like doing some life coaching that sometimes people don't want to put in the work but they're like, oh, I'm going to try this and pay for it. But when it comes down to it, I'm not really willing to make these changes. And it's like, well, then why are you coming to me? But if they've like gone through this course and they're like, I need more of this, like I'm willing to invest, at least they were willing to invest their time in doing this course. And so then, where they're at,
Amen. And they know where they're at.
Right.
They know that like, okay, well, I don't really need to go spend $3,000 to work with this person when I'm still trying to like even eat breakfast every day. So like, let me save myself the time and money and let me actually get this in line. And then what do you know? They become pregnant when they start eating regularly and sleeping at night and, all of that kind of stuff.
I miss that so much.
Do you?
Oh, my daughter does not sleep through the night and it's so stressful sometimes. I was telling my husband this last week because we were talking, he and I are doing this challenge for the month of September that at 7 p.m. we have no technology, no TV, no iPad, no cell phone, no anything. We shut everything down at 7 o'clock every night. And it's just been awesome. Like we play cards, we like read books, the things that I'm like, oh, I don't have time to read this book. And I'm like, oh, wait, I do because I'm not scrolling on my phone. So, and we were just talking about like how important sleep is and how it's so good for your health. And I'm like, that's so triggering to me right now because I know the importance of sleep and I haven't slept through the night in over a year. And I would love to feel rested and great, but I don't. So, and there's not much I can do about it because my daughter has some high needs. So, and we were working through
Trust
it. So
me,
I'm
girl,
like, it's hard.
I've had to face that same thing. And I had to make some seriously tough parenting choices when it came to that. And that was,
it's hard.
Do an episode on that someday about.
We have 5 episodes lined up with Sophia for the future. So.
About like becoming the mother that your baby needs. Because there were things my baby needed in order to sleep through the night. And they were hard for me. They were not easy. I didn't want to do them. I thought I will do anything besides this. No way. And I had to suck it up and do what was right for my baby. And it was the worst. But now it's the best. Because at the time you're like this, no, I can't do this. I mean, it's just like anything. Like you don't want to. It's hard to be a mom and it's hard to make the decisions that are like, this is what's best for my family. And it sucks and it's hard and I don't want to, but my baby needs me to be tough and she needs me to be, I'm the only mommy she's got. And if I'm not going to do what she needs, she's screwed. Yeah. And so I don't want to screw my baby over. I need to get over myself and I need to do what my baby needs in order for her to sleep and for me to sleep. And I'm sad.
That makes me sad.
And I'm like, overall, God, I'm doing it. Here we go. Like, I think this is what you're telling me to do. And so I'm going to do it and you have to help me. And what do you know? He did. Yeah. And my baby slept 12 hours last night.
That's awesome.
Well, she woke up once for milk.
Yeah.
But it was, I feel you so much on that because that was majorly hard. I don't, well, I feel like to be a woman. I don't want to.
I know there's so many things.
Talk to my doctor.
Yeah.
I don't want to try. I just want it to happen. Can't we just have lives that just happen? But it doesn't work like that. Nothing in life worth having just happens.
Well, and I mean, it does make us stronger and it makes us, I don't know. I feel like being a woman and learning how to advocate for myself has made me stronger because especially becoming a mother, I've had to learn how to not only advocate for myself, but for my child. And advocating for her has taught me more how to advocate for myself because I'm like, I have to teach her. I have to show her if I'm letting people walk all over me, she's going to think that's normal. So I feel like the tough things have definitely made me stronger and it showed me how much I can do because before I had a kid, I'm like, I can't survive on no sleep. And then I had a kid and I'm like, I'm still functioning in this world. You get this like strength from deep down and you just do. And not that I don't get any. She woke up twice last night and she usually just nurses and goes right back to sleep. But I mean, it's the tough stuff. We have a lot more to face as women, but I also feel like it makes us so much stronger too. But there are the times where it's like, why can't a guy just deal with this issue? Like, I wish you just knew what it was like
Listen,
to
they've
feel
got
this.
their own problems, okay? Trust me.
I'm sure.
It is not any easier. It's just different. And the grass is always greener.
Oh, for sure.
But anyway, I'm going to have to wrap it up because I got to hop on another call. But
Yes.
Liz, it was wonderful to be on this episode with you. Listeners, if you want to find me, the best way is to follow me on Instagram at ttc.nutritionist. My name is Sophia Pavia. You can remember it because it rhymes. Search me online either way. And thank you so much for having me on today.
Yeah, thanks so much for coming on, and I'll have all those links in the show notes. Make sure that you go follow her on Instagram, and you just listen to those tips that she gave for asking your provider the right questions if you're trying to conceive and not just being told, okay, come back in here. Because sometimes that answer is not good enough, especially if maybe you notice something is off in your body, and being able to have that honest conversation with your provider, and a provider who wants to work with you in solving that. That is really important. Like I said, next week, Vito's going to be on the podcast. Reach out. Let us know if you have any questions for us. A lot's happened, I feel like, since the last time he's come on, and I'm excited to have him on here. And make sure you reach out and let me know who you want to hear from, what topics you want to hear, and we'll do our best to make that happen. All right. Love you. Bye.
If you want to be the most interesting person at the cocktail party, well, hop on over and listen to the Brain Candy podcast.
Our award-winning content will have you laughing while you're learning.
We read all the best articles, books, and studies, and keep up with new TV shows, documentaries, and pop culture. And then we cram it all into 2 shows a week.
Conspiracy theories, cannibal rabbits, unsolved mysteries, the history of the Walkman. There's something for everyone.
The Brain Candy podcast. Find our link in the show notes.
Or simply search for the Brain Candy podcast on your podcast app.